The effects of tDCS and schizophrenia. Schizophrenia is a psychotic disorder that affects the structure of the human brain, causing abnormal behaviors through a series of related symptoms, disrupting the process of thought and emotion. The actual cause for schizophrenia is not fully understood. However, there are several factors that increases the risk in developing this condition, and it is most likely due to the combination of genetics and environmental influences. The risk in developing schizophrenia through genetic factors is much higher, with a 1 in 10 chance, in comparison to the population with a chance of 1 in 100. If the child's parent or sibling is a carrier, the child will have a 10% chance of risk. If both parents are carriers, risk is increased to 40%. And if the child happens to be an identical twin, the risk is then increased to 50%. In biochemical factors, an overactive neurotransmitter called dopamine has been linked to cause hallucinations and delusions. Within the prenatal period, exposure to viral infections and malnutrition increases the risk in developing schizophrenia as well as birth complications. Substance use, from amphetamine and cocaine, is known to cause paranoia and hallucinations, and the use of cannabis has been linked to cause permanent psychosis. While substance use does not cause the condition, it is strongly related to relapse. Trauma and stress, experiencing violence, traumatic events, and severe stress also increases risk. And specific seasons of the year. Studies have found that the risk is increased by 5 to 10% when born between January and April. This is related to the lack of sunlight exposure from the mother during the prenatal period, leading to vitamin D deficiency, which scientists have suggested an alter in the development of a child's brain in the mother's womb and after birth. Schizophrenia is predominantly a young condition, affecting both men and women between late adolescence and early adulthood. Unfortunately, schizophrenia is commonly dismissed during late adolescence, as this is the time for emotional and psychological changes, which is a normal part of the developmental stages of life. Schizophrenia can also develop in older adulthood, where detection is almost immediate. Schizophrenia is divided into two categories: positive symptoms and negative symptoms. The positive symptoms correspond with psychotic behaviors, which include hallucinations, delusions, cognitive disorders, and movement disorders. The negative symptoms correspond to the missing characteristics of emotion and behavior, which includes social withdrawal, decreased motivation, the flat effect, reduced feelings of pleasure, and poor hygiene. Schizophrenia begins with negative symptoms, and if left untreated, will most likely develop into positive symptoms. Schizophrenia is a progressive neurodevelopmental illness and changes both structure and function of the brain, and is therefore very different to a non-schizophrenic brain. Researchers have reported seeing up to 25% loss of grey matter in certain brain regions, as well as a 3% loss in brain tissue. And as a result, the brain is 5 to 7% smaller in comparison to a non-schizophrenic brain. Schizophrenia affects all subjects differently, but it is known to heavily impact the prefrontal cortex, basal ganglia, limbic system, and temporal lobes. The temporal lobes appear enlarged in MRI scans, which is due to the lack of grey matter. Grey matter is involved in the hearing, speech, memory, emotions, and sensory perceptions, and is therefore an important element in the structure of the brain. Other affected areas of the brain is the amygdala, hippocampus, thalamus, and nucleus accumbens. There is no quick fix for schizophrenia, but there are many treatment options that have demonstrated a successful road to recovery. A new type of treatment is the transcranial direct current stimulation, also known as tDCS. tDCS is a non-invasive neurostimulation that uses low electrical current that runs between 0.5 and 2.0 amps. This type of current does not trigger an action potential. Rather, it works by bringing a neuron closest to the firing stage. The delivery of the current uses two electrodes placed on different parts of the scalp. The anode electrode contains a positive voltage and is used to facilitate depolarization, resulting in excitatory stimulation. The cathode electrode contains a negative voltage and is used to induce hyperpolarization, resulting in inhibitory stimulation. The current enters the body under the anode electrode, flows through the brain, and exits through the cathode electrode. The duration of a tDCS treatment is generally between 20 and 30 minutes, and it is believed that with enough stimulation and repeated exposure, the stimulated neurons will begin to fire more, encouraging the damaged or underperformed brain regions to function better. For schizophrenic brains, tDCS is an effective type of treatment as it has been reported to reduce auditory verbal hallucinations and positive symptoms, especially when placing the anode electrode over the left dorsolateral prefrontal cortex and the cathode electrode over the right supraorbital region. The strength from the results of tDCS differ among all subjects, therefore leaving room for future investigations on the treatment of tDCS and schizophrenia. A common suggestion from a number of scientific studies proposes a combination of tDCS and other treatment modules as the main focus in coming years. Another proposed suggestion is combining tDCS and cognitive training for future research, and also increasing the number of electrodes, as well as combining tDCS treatment with pharmacologic treatments.